Hello everybody, this is Dr. Kawthar coming to you from Muscat, Oman. Tonight I'm going to talk about stress and the rage cycle, anxiety and children with autism. Children and adolescents that have autism are prone to anxiety and stress. In fact, anxiety disorders are one of the most common coexisting conditions in children with autism. Children with autism spectrum disorders may be thrust into confusing social situations that are difficult for them to understand or to handle. There are sometimes rigid rules about change, and their innate emotional vulnerability make it difficult for them to manage certain events that other children may readily dismiss. As a result, they may experience a lot of stress, which causes them to withdraw or become preoccupied with obsessions and thoughts. They may also become hyperactive, aggressive, and difficult. To compound the situation, many of these children have difficulty realizing the stress that they feel, and they see no problem with their behavior. Many experts and specialists refer to this sequence of events as the rage cycle. In the right setting with the right triggers, most of us can become entangled in a rage cycle. However, with most children with typical development create strategies for dealing with situations that make them upset or angry. Certainly by adulthood, most children and adolescents can better handle upsetting stressors. Children with autism spectrum disorders, however, are more vulnerable to outbursts because they are naturally more prone to anxiety and have less self-awareness. It is important to understand the meltdowns occur for a reason. There is often a reason or a cause for the angry behavior. This is why functional behavior analysis, or FBAs, as I discussed before, are important to understand the behavior of the child with autism. Exploding into a meltdown is not something any child wants to do, but it's often the only way the child can express himself because of his communication may not be adequate. Parents and teachers can help reduce the child's anxiety and stress by understanding the rage cycle and deploying strategies that help the child manage their stress. It is also important to improve your child's understanding of social situations, arm him with the skills for living and working in a world with other people, and master communication skills that will help him express himself. The rage cycle has 3 phases: the rumbling phase, the meltdown or rage phase, and the recovery phase. Early in the cycle, there are distinct strategies for preventing or decreasing the problem behavior. Now, firstly, we have the rumbling stage. The rage cycle begins with the rumbling stage. At this point, you may notice some minor behavioral changes that have little to do with the impending meltdown. The child may be clearing his throat, he may lower his voice, he may tense his muscles or tap his feet. Facial expressions may give away of feelings of unhappiness. Other behaviors may be more obvious. The child may withdraw physically or emotionally from what's going on around him. He may lash out verbally at someone else. If it's happening in a classroom, the child may attempt to engage in a power struggle with the teacher. Nipping the problem at the rumbling stage is critical for preventing a meltdown, and teachers and parents have several strategies that they can use. These include the first one, removing the child from the situation. If the problem occurs in school, the teacher can send the child on an errand. If it happens at home, the parent can ask the child to retrieve an object. The brief absence can help the child to regain his calm so that when he comes back, the problem has usually lessened. Moving closer to the child. When a teacher senses a child's distress, she can just simply walk over and be near the child. Parents can do the same thing. Simply putting yourself closer to the child can lessen the stress without just disrupting others. Signaling the child. A teacher who has a child prone to rage can work out a signal which can be as simple as tapping on a desk or putting a pencil behind her ear. It can reassure the child, and it can be used just before removing the child from a situation. Redirecting. Shifting the child's attention to something other than what is upsetting him can often help reduce his stress. While it's okay to postpone new activities in some situations, in others he may need to be redirected immediately. The child may also be redirected to a pre-rehearsed common sequence or use relaxing techniques that they have been practiced with the therapist beforehand. Giving him a place safe to go. We call this a home base. A place where the child can go to escape stress. A safe place that should have minimal distractions and activities, and the area should be soothing, not stimulated. In school, there could be a safe place in the classroom, such as a table in the corner. And when that's not enough, another safe haven can be outside the classroom, such as in a counselor's office or a corner in the library. At home, it might be the child's room, or even a tent set up in a playroom or in the child's bedroom. Wherever it is, the safe place should be viewed as a positive retreat, not an area for a time out or used for punishment. It might also be used as a place for the child to regroup during the recovery phase. Acknowledging difficulties. When the rumbling stage is triggered by a challenging task, it can sometimes help just to simply acknowledge that the task is hard and then encourage the child to proceed anyway. A simply verbal acknowledgement may be enough to prevent the child from having a tantrum. Walking, not talking. This is the last one that I have. Taking a short, silent stroll with a distraught child can sometimes help smooth the child on the brink of a meltdown. The accompanying adult should say nothing while allowing the child to vent any upsetting emotions without any consequences. As you can see, these strategies are not difficult to do and are in fact sometimes quite simple. But the effect that they have on a child's impending meltdown can be huge. The key is knowing which one to use and in which situation, and not allowing yourself to become part of the struggle. It is also important to avoid certain behaviors that can escalate the child's rage and almost guarantee a meltdown. These include raising your voice, focusing on who's right, preaching or lecturing, being sarcastic, using physical force, acting superior, pleading or bribing, and insist on having the last word. An adult should never attack a child's character, compare the child to others, or insult or humiliate the child. Now, the next phase is the meltdown or rage phase. If you are not able to diffuse the situation in the rumbling stage, the child will go on to the meltdown or the rage stage. Behavior at this point is erratic and out of control. The child will no longer have the ability to process information and may be quite physically aggressive. He may be hitting, kicking, and biting. Or he may be verbal abusive. He may hurt himself or others or damage property. In some cases, the child may completely withdraw. Most of the time, the meltdown will just have to run its course. The focus at this point should be the safety of the child, his classmates, and adults. It is also important to try to help the child regain some semblance of control by whisking him off to his safe place or enlisting the help of other people in the school staff, Ideally, a plan should be in place before a meltdown occurs so that staff and teachers are fully prepared. Now, the last phase we have is the recovery phase. When the meltdown subsides, the child may feel badly about what has happened. He may not also fully remember what had occurred. He remains fragile and may need time to rest before rejoining the class or the family. The recovery time is not the time to teach the child new lessons or lecture on what has happened or his behavior. Rather, the best thing to do is help the child simply fall back into the class or home routine. A teacher or a parent can do this by leading the child to an activity that he enjoys and he does well. By understanding the state of the rage, both teachers and parents alike can help the child with autism deal with stress and prevent bad situations from escalating into full-blown meltdowns. It often takes time to figure out which strategies work best with each child and in which situation. Over time and with practice, a child may even learn to find the strategies that work best for them and be able to apply them to other stressful situations. Understanding and using educational services and strategies are important to help your child feel successful in a school setting. Thank you for listening and have a great day.